It's a really good question when you think about how do I prevent myself from ever getting to the point that I need to see Dr. Daley or Dr. X to have a knee replacement. And there's a multitude of factors. And first of all, it's what God gives you. It's genetics is the most important thing. So if your mom had a total knee when she was 62, probably you're going to have a total knee when you're 58 or 62 or 64 as well, unless mom's total knee was because she had a major trauma when she was younger. It's the same as someone with heart disease, and we're at risk for heart disease. If your daddy had a heart attack, then we're at risk to have a heart attack as well. Having said that, there are certain things we can control, and in this country, it's our weight. There's no question about that. We talked about that a couple of times. So, but it's like the same old adage that, eat well, sleep well, get enough rest, get regular exercise. How many of us in this country do that? Relatively speaking, compared to the true best optimal body mass index, we're all obese. I'm obese as well by those standards. And I'm 210 pounds. If I weighed 185 pounds, I'm sure there's much less stress on my knees. So that's the first thing. But the only other way otherwise to do that besides the regular healthy activity is to live in a bubble and avoid stress on your knee. So it means you're gonna grow up as a child without doing any sports. You're not gonna fall down. You're not gonna play football. You're not gonna play tennis or hockey, and that's impossible. So I think it's just healthy living, and then what's going to happen is going to happen. Now there's no doubt that that by being silly and taking risk with our body, we're probably at more risk. But there's no way to take the risk from 20% down to 0% that I'm aware of. A lot of these supplements we talk about, and they push like glucosamine, chondroitin sulfate to rebuild the cartilage in your knees. We don't know if that actually can work or not. We know that it's probably a natural anti-inflammatory, but whether or not it can really rebuild cartilage, we are doubtful. In this country, we can't set up an FDA-approved study to sort of have someone take this, someone take that, someone take a placebo, and then scope their knees because it would be unethical. But there's nothing scientifically at this point in time to support the claim that companies make that by taking these cartilage replacing supplements that they can actually rebuild cartilage.
9 years of football. My knees are pretty bad shape anyway. I'm going to turn 50 next winter. I am segueing over into nothing but swimming and elliptical training. Smart move?
Smart move. Certainly low impact. Cycling, biking, swimming, walking, low impact. Having said that, some people love to run and they run into their 70s and their 80s. And if you want to run or want to jog, then if you want to do that, then I would suggest you really look into learning how to, if you don't already, midfoot strike. Another sort of take on that was something called chi running. It's just a variant of midfoot striking, and that does reduce some of the stress in your lower extremities. But having said that, running tends to be harder on our bodies. And I'm like you. I'm tending to go to elliptical trainer, biking, swimming more. I still run a couple times a week, or maybe more like jog now. But that's a smart move, no doubt, smart move.